kind of makes it difficult if you have 3,000 patients for you to see every single patient. So most of the time they end up seeing the nurse practitioner, and they don't like that.
What up, bro?
What's up, man?
How you doing?
Feeling great, bro. This Doc Talk 30 got me feeling like in good shape.
Yeah, bro, you look good, honestly.
I mean, the episode before that, it didn't look so good.
Yeah.
It depends on what I'm wearing, honestly.
I don't know. I don't know if I haven't weighed myself, but Caitlin told me that she gained a pound.
Yeah. But that's probably muscle.
Yeah.
Thanks
all
for
muscle.
exposing her on the
And Thomas grew an inch.
Yeah,
He's
2 inches.
He grew 2 inches? An extra 2 inches?
Yes, sir.
Fantastic.
I think, what do we have, like 74 people now?
Yeah, 74 members.
74
on the Doc Talk
members.
channel. That's not bad at all, actually. It's pretty awesome.
I can't wait till we all meet up and then kind of like do the mile together.
So that's something we should probably talk about to run the mile together, and it's gonna be fun, man. It's gonna be fun. So do you have somebody in mind we have a lot of active people. I have some people that are in mind that have been active every single day. I have an idea, but I'm not gonna mention any names right now.
Yeah, let's not do that.
I know. But anyway, so this topic today, we were talking the other day about like accessing healthcare, and I thought like this would be a great topic to talk about, and
like getting in with your doctor when you need to.
The struggles with patients trying to find an appointment. Oh, I need to see you today. You know, my head hurts. I got a rash, and I don't want to go to the ER. And this has been such a headache, and I feel like it's getting worse day by day. Do you get a lot of that? Do
you feel like it's specifically Florida, or do you feel like it's everywhere in the U.S.?
Okay, first of all, that's a great question. I wouldn't know.
1 million people a year are moving here to Florida?
Well, I heard it's 1,000 people a day.
Yeah.
That's what the census said. But also, I mean, it's all of Florida, right? I mean, North Florida, Central Florida, South Florida.
I think it's more than that. I think last time I looked, it was like 790,000 people last year moved here.
It's
but
crazy.
also 200,000 moved out.
Yeah,
so, yeah.
And a lot of people moving out. But at the same time, it's like, I get it, but we can barely keep up. I can't keep up even in the office, and you can't really start seeing a bunch of people because it's going to affect the quality of care, and that's my issue. We need more doctors, we need more nurse practitioners, we need more physician assistants, medical assistants, nurses. I mean, the list goes on.
The problem even with that, so like even when I hired my nurse practitioner, it seems like all the patients just want to see the doctor.
Yeah.
And it kind of makes it difficult if you have 3,000 patients for you to see every single patient. So most of the time they end up seeing the nurse practitioner, and they don't like that.
No, you're right.
And I wish they would kind of change that, but...
Well, you know what's funny is that I actually spoke with my operations manager this morning, and we had that issue because a lot of patients have been, if he's not there, I'm not coming in, right? I think what we need to do is for a lot of your new patients, you need to make it aware that, hey, listen, Dr. Jabawi might not be available. Are you okay seeing a nurse practitioner?
Yeah.
And if they say no, well, we can't guarantee that you're not going to see the doctor because of the availability.
Yeah.
I think we have to be kind of very discreet with the patient and tell them, listen, we're going to try to be there for you as much as we can, but there are times if we're on vacation, we're sick, and we're unavailable, and you need to be seen, well, your health is priority,
And that's why kind of developing a good relationship with your patient is so important. I feel like once they know you, like some of my patients are like, no, we want you to take a break.
Yeah.
I'm okay. If you have to cancel my appointment because you're on vacation, go, man. You've worked so hard. You already developed like such a good relationship with them. I think also like Caitlin was talking about earlier. So like what happens if you have like an injury or if you have a UTI and you can't get in with your doctor, then what do you do about it?
Yeah. Well, I think we got urgent
cares are packed.
Yeah.
Hospitals are packed. And then especially for people that like need stress tests, echoes, all of this is taking forever.
Yeah.
So getting an echo, it takes a week to get the report back. What if somebody has end-stage heart failure? Or what if they have aortic stenosis, severe aortic stenosis, triple A's?
Yep.
It's
Dangerous.
about to rupture and then you don't get the results until it's too late.
Exactly. Well, honestly, personally, I've been thinking lately, like I feel like every single, at least primary care physician offices need to have a section of a walk-in. I feel like it'll just take away a lot of stress just for these type of situations.
Because hate the hospital.
If you have 150, 200 patients, I get it. You don't need it. But I have 3,000. You have 2,000.
Yeah.
That's 5,000 patients that we are responsible for. I mean, it is impossible for me to see every single complaint. It's just not feasible, without affecting quality of care.
And then also it starts affecting your name because then a patient goes in, doesn't see you, writes a bad review,
upset,
and then it slowly gets worse.
Yeah.
And I think that's why, do you think, and we talked about AI so much last episode, do you think that AI can maybe relieve some of that stress, where like somebody has a UTI and then it just gets filtered through and then the antibiotic gets called in and not have to like really go through that process?
I think that would help tremendously, but I don't know how long that's going to take for that to really take into effect. You know what I'm saying?
So what do you suggest to fix it? Like what are some options to fix that?
I think I honestly believe that we need to promote more students, young people, to go into medicine and to go into whether it's nursing, become a nurse practitioner, physician assistant, or what we can do is hire. See, if there was liability is a big problem, but if there was like a person that I can depend on, and it doesn't necessarily have to be a nurse or a medical assistant, a person that can just take the information from the patient and present me while I'm working. Hey, listen, we have John who's complaining of abdominal pain.
Does everything
real quick for me, and then I'll sign afterwards. It'll take off some tension, you know. Yeah. But at the same time, then there's responsibility and compliance and legalities. It's such a headache. The only way is to just fill your offices more with providers. Simple as that.
Do you believe more people or less people are going into medicine nowadays?
I think less people are going into medicine, to be honest with you. I think the dreadful, and you know, a lot of these companies now don't even require a bachelor degree, so people are not going to school anymore. Yeah. You know, that people are
because people
online.
Are getting bachelors and masters and can't even get a job.
Yeah, because they can't get a job, or it's like $30,000 starting salary, but they owe $100,000 in student loans. It's going to take them forever to pay off their loans. It's not enough to survive these days. $40,000 is not enough money.
It's not enough.
It's not
enough
money.
And also, I feel like a lot of companies, even let's talk about outside of medicine, they rather get somebody with experience than just the education.
Absolutely.
And it was never like that before. You have to have the education. Yeah. And also, like, so many podcasts, so many people are talking about how like the education system is rigged and it's really not, kind of like what is the point of taking physics if you're never going to use it? What's the point of taking these classes when they're not useful, right?
Yeah, absolutely.
And so people are kind of just opening their own business, doing their own thing, and they're succeeding more just by doing that. And there's a lot of people leaving medicine in general, and they're honestly happier, which is sad to say, because people are saying, okay, I'm going to work 12 hours a day, make $300,000. I'm going to plateau my whole life, and I'm going to stay where I am. And it's the same lifestyle.
It is.
Wake up the same time, go to sleep the same time.
Repetitive.
It's the same exact thing.
It's repetitive.
And it kind of gets old.
It is. It's going to come to a point where you're just exhausted and burnt out. And that's the issue. But like going back, like, the other day we had a point, like I like it when patients who come in, for example, and so, you know, if they call you, oh, hey, doc, I forgot to mention, you know, that's 2 hours after they left the office. Come in with a list.
Yeah.
Come in with a
list.
Be organized. Come in and just write down a list. Keep it on the fridge. When you go to your doctors, grab it and talk to them about these things. Bam, bam, bam. The average time that doctors really should be spending with patients, they say on average, is about 6 to 10 minutes.
No way, man. I spend way more.
We're a little bit different because it's managed care. Yeah. You know, but I'm talking about like the normal doctors.
The problem with that? I'll tell you what the problem with 6 to 10 minutes is that the specialists are not doing it. Yeah. So like, let's say you get a patient that's depressed. He's seeing a psychiatrist. The psychiatrist is just giving them a med and not spending any time with them. Then the load comes back on you.
As a
cardiologist, you go see the cardiologist. They have a stent or they have open heart. They don't go over what medications they need to be on, how long they need to be on Plavix, how long they need to be on the meds. So that falls back on you. And this trend of just everything is follow up with your primary care. Everything. Even when you discharge a patient from the hospital, they don't give them a breakdown of what medications they need to be on, what were you discharged on. The discharge summaries are not done on time, so everything falls back on the primary care. The primary cares are burnt out.
Yeah, they expect the patient to know everything also with the medication that was given.
You can't fix the system unless everybody fixes it. The specialist, the ER, the urgent cares, the hospitalist, the nocturnist, all of those people need to spend more time with the patient. It can't be all on the primary care.
They do.
So like, and also another thing I feel like when you are a person in medicine and you create it into a business, sometimes I feel like it affects it.
Yeah.
Because then you look at a patient as like a number. Like, how many patients can I see and how much money can I make?
Yeah.
And so I do feel like patients say that. Like when I see a doctor that owns his business, I feel like he's just rushing me.
Yeah, but it is. That's because it's a fee for service, right? So the more patients you see, the more money you're going to make. Yeah, but with managed care, so that's the good thing. I think that managed care model is changing a lot, and I feel like that's the future for medicine in general.
Can you like let people know what that is and like why it would change? Like what is managed care? What is Advantage plan?
Managed care is just a focus-based type of care, and a lot of it is just Medicare Advantage plans and contracts.
But what is it? Like what makes it different than a fee for service?
As the primary care doctor, you're the central kind of hub for this patient. You can see them 10 times a year. You can see them twice a year. The secret is to prevent hospitalization, to keep the patient healthy and out of hospitals and not sick. You don't charge the patient per visit. You know, you get a lump sum per patient, typically at the end of the year from Medicare. Of course, it's like a bucket of money, right? The more patients you have, the more money is in that bucket. But the more the patient's hospitalized, the more the patient is referred to a specialist, they take that money out of that bucket. Okay. So as a primary care specialist, you want to keep these patients out of these, referrals and hospitals in order to kind of keep some of that money.
I wanted to ask you a question. Do you feel like if you did spend that extra little time with the patient, they would call less, they won't bother you as much? Because I'll give you an example. If a patient leaves the hospital and you went over the medication list, you told them exactly what they need to do, you gave them a diet, you got the physical therapist, and you organize it, you spend an extra 15 minutes, they're not going to call you back. They're not going to want to be seen again. They're not going to go to the hospital. So I do believe that extra time you spend with a patient is so crucial, and I feel like it saves you in the long run.
Yeah, I agree. I don't think it'll change it drastically, because I feel like our patients, for some reason, 3 daes later, they're just like, you know what? That medication you gave me is not working. You sat there for an hour. You gave her everything she needed. I don't know. I think, yes, it will help, but I don't think I think that there has to be some sort of filtration process for that specific time. If I just saw you 3 days ago and you just had a question that you need to talk to, there should be somebody else to be able to handle that problem for you.
But also, the patient needs to take responsibility too. So we talk so much about how do we change medicine, but the patient needs to take responsibility. Like, if I give you a diagnosis or if I give you a medication, you should look up what that medication is and what that diagnosis is, and do some homework. There's AI. Just type it into AI. It'll give you everything you need.
Yeah, and don't expect your body to take care of you if you don't take care of your body. I always say that, right? I mean, a lot of these patients are pissed off about certain labs or values, and that they don't really care. They smoke, they don't hydrate, they don't exercise, they eat whatever they want. We're not gods. You know what I'm saying? If you're not taking care of yourself, you're going to see abnormal labs. You're going to feel horrible. You're going to feel that chronic fatigue. And when doctors tell you to change your lifestyle, change it, because you're going to they complain the same thing every 3 to 6 months. It's because you're not doing anything different. You have to start doing something different,
But what about like when a patient goes see a doctor and he just says diet and exercise?
Yeah, well, that's a problem.
Like what do you mean by diet? What am I
they're
supposed
not
to
all
eat? How am I supposed to
exactly.
And that's what I mean.
Like, I mean, you don't know. They don't know what that means. You got to explain it to them. Well, that's why sometimes maybe you could hire somebody to educate the patients in your office. Somebody who's maybe a nutritionist, or somebody who's just educated on how to, live a long, healthy life, and that might help. See, that might take some time off you. Maybe when they're done with you, they can see that person, and they can just give them the rundown or list. Sometimes you can just print out information, let the patients read it. That's another thing too. So
I hope it changes. I mean, we're trying our best, but it can't all be on us. And
and go easy on your doctors. They're overworking, and they really truly care about you. But you also
they forget that we're humans too.
Well,
they don't understand that you need a day off, or you got sick. Like I had a patient that got so mad one time. I got sick, and like, how can you not be there? I waited. I'm like, I'm sick. I'm trying to prevent you from getting it. Like,
they don't understand. Unfortunately,
I'm also human. Like,
you have a life. You have family, and you need a break too. So I agree. But listen, be patient with your physicians, your physician assistants, your nurse practitioners, the MAs. We try as hard as we can to make sure that you have everything that you need. Bring a list to your doctor's office.
Organize it. Make it
Organize
simple.
it. Come to your appointments on time.
And don't have 20 problems.
Exactly.
Like if you're going to go for a visit and you know you're going to see him again in a month, maybe just pick 2 or 3 problems, focus on those problems, try to fix those problems, and don't come in and stack them all up and go see once a year with 50 problems. There's no way you can handle all of them.
It's impossible. But man, I think that was an awesome topic.
Yeah, man.
I think we can talk about it also in the future. And thank you so much for coming down.
Yeah, Happy New Year.
Yeah, definitely, man. It's gonna be a great year. Happy 2024, everybody. Love y'all.